Hello, folks. So, in this video, I wanted to talk about a recent health scare that I had. Around, I think today is Thursday, right? Today is Wednesday. Okay. I think on Monday, so this was 2 days back. I woke up and I had some cough. And I was coughing. I was lying down. I was waking up. I was lying down before waking up, and I was coughing. And I realized that I have a pain in my lower back on the right side, right, kind of close to the hip where you wear a pant and all, right. It was very weird because whenever I coughed, only then I felt the pain. And I got up, and when I was coughing, I also realized that coughing also, of course, causes a movement on the sides on the hip, right? The pain I had was just in my lower back hip, on the side between the spine and the hip, almost in the center, so at the lower back. And I was like, what is going on? And I was starting to check out what is going on, as in, like, I was trying to understand the body, and I was like, do I have any movement in my body in the lower back on the left side also, similar to the right side? Because I felt a movement and I felt pain. So on checking, when I coughed, I also realized that on the left side also there is a small movement apart from the movement on the hip, left side lower back. So I realized that there is movement on the left and the right side lower back, but there is pain only in the right side lower back. And I had multiple suspicions. First thing is, I've had lower back pain before, right? I think it was around a few years back, around just after a few months after COVID started. So I was sitting a lot and working, and I was like having back pain suddenly, lower back pain in the left side. So, and I went to the doctor, and they asked me to turn around and all, and and also bend down and touch the toes and whatnot. And then they said, this is probably just because of sitting in front of the computer and sitting a lot. So they asked me to go to a physiotherapist, and the physiotherapist told me about how to do some exercises. I also had some neck pain a bit, so they told me many stretches and exercises, mostly stretches. I will probably take a video of that separately, but for example, for the neck, I had stretches like look down, look left, look right, and things like that, and then do this and whatnot. I think there were more. I just don't remember all of them now. And there was this, like, stretching, and there was this, and then looking up and down and whatnot. And I also had stretches for my leg. For example, lying down on the floor, straight, and raising one leg up 90 degree to the torso, and the next leg, and then both legs together and things like that. And then also, while lying down, just pull my knee towards the chest, and one knee towards the chest, and then the other knee, one by one, one thing at a time, and then later both of them together towards the chest, bend it and hold it. And then there were some more things. I think one was called cat and cow, something like that, where you lie down on your basically on your limbs, on your hand and leg, knee, and not lie down, more like be on your four limbs, kind of like a cat or dog. And then, like a cat, you have to push your spine up, and then later push your spine down, like curve it, and things like that. I'll show you probably in a separate video. And I also have some images of what was done. And I also did some stuff like similar to Surya Namaskaram. One of the poses is you lie down, facing down, your face facing down, and you look up and bend your back, right? And then also lifting your leg not 90 degrees, like lying down and facing up, and lifting your leg not 90 degrees, say 30 degrees, 45 degrees, and holding it, similar to holding it with 90 degrees, and same for the other leg, right? And what else? Yeah, I mean, I had some of these. So this was for my lower back pain. This was years back, right? This time, I still sit a lot, so I was wondering if that is the case, lower back pain, or I had gone for a run the previous day on Sunday, so I was wondering if that caused any problems. For example, during the run also I had some pain in my foot in one place. Apparently that is a tendon. A physiotherapist mentioned that it's a tendon. The end of the calf muscle. The calf muscle is where the calf is behind the shin, and then from there it goes till the foot near the tendon, and that's where I had the pain. They said my calf muscles were tight, and hence the pain. It was only on my left leg. Right? So I actually stopped running in between, and I was just walking around because I realized that there is pain and I didn't want to injure myself. I would rather get delayed in my run, in my race. It was a race. It was a 10-kilometer thing run, and yeah, later I did start running again after walking for some time because I realized that the pain was lessening, it was going down, and there was very, very little pain. So I tried to ensure that I didn't put too much pressure on my left foot. Right, so I was just wondering, did I put too much pressure on my right foot, and did I put too much pressure on my hip, lower back, and all? So that was one thing. And I had also lifted my partner the previous day, and I usually do lift her. The thing is, the run was unusual because I didn't run for like some many months, around probably 8 9 months. So suddenly I just started running, and I went for a 10 kilometer instead of slowly starting it. That was a bad idea, and I didn't also stretch properly. I stretched a bit, but not for a long time, and not all the muscles, leg muscles and hand muscles and chest muscles and whatnot, and the hip and everything. So and then yeah, I mean, I also picked up my partner. That is usual. At times I do pick her up, but then that day I think when I picked her up, I actually bent my back too much when I picked her up. So yeah. So these were some of the suspicions. So I was just wondering, do I have a lower back pain or do I have a hernia? Right, and I was reading through that, and my partner was like, "Don't read. Let's just go to the doctor because you'll get the wrong ideas." Right. This is how people, for example, people Google something and then they think they have cancer or something really bad. But yeah, I was just trying to guess and understand based on my history and based on what all happened recently and whatnot. So I was like, okay, let's go to the doctor. I had actually already checked about lower back pain, specifically lumbar. I think this was mentioned to me years back when I had lower back pain in the left. So they told me I think the lumbar was the problem where I had pain. Lumbar is one of the parts in the spine, and they said your spine is a bit curved, so you need to straighten it and also do many exercises. And they said hamstring is tight and you're not fit and all that. They asked me to do exercises and be fit and not sit for a long time. This was years back. I went to the doctor, and because I have had a friend who got hernia because of lifting someone. So I was like, let's ensure that I don't have hernia because I checked the symptoms of hernia, lower back hernia, the lumbar hernia versus lumbar pain. The some of the symptoms are same, but some of them are different. For example, with the lumbar hernia, you have a pain that radiates to the, I think, the whole of the leg and all. And usually there is a bulge and whatnot, but it's possible that there's not much of bulge and all that. And yeah, I mean, there are many symptoms. So I was just worried that if I have a hernia, and I've had my friend have hernia in his, I think his intestine just popped out, as in from inside, and just pushed. And also he was wearing some belt and all to ensure to keep his intestines, proper in place. and then later he got a surgery, I think, mostly a non-invasive surgery, very less invasive. And so I just went to the doctor, and doctor said it's not any hernia or or anything related to the hip disc which moves away sometimes if you do something wrong. They said my hamstring is tight. They actually checked if my leg movement is free and all. So this was something that was done last year also when I had a knee pain, and they said I have to stretch more and warm up and whatnot, and have my hamstrings more flexible. It's very tight and whatnot. So they pulled up my leg 90 degrees to my body where I was lying down facing up, and they checked if the hamstring is tight and all, and then they bent my knee and all, and they checked all that, and they asked me to um, you know like sit with my legs straight and try to reach my toes and all, and then they also tried to ask me to stand and then keep my leg on the bed where I was lying down, and stand on the floor and keep my leg on the bed to actually have a right angle towards the other leg so that they can see how much can I actually lift easily. And they also asked me to touch the toes just one leg at a time, and they said it should be easy actually. So they said it's not because of the other stuff, but more like my hamstring has to be flexible and not tight and whatnot, and I have to stretch and I have to exercise more. And if I don't, then the other stuff will lead to, they call it as rebound issues, rebound pain. So if the hamstring is not flexible and it's not, if it is tight, then you can have back pain because of that. So yeah, and thankfully it was not a moved or not replaced, but like a moved disc or hernia or anything of that sort. The doctor didn't mention about the joint or which part of the spine is it. I think it is lumbar, but in the previous times they did mention for lower back pain it was lumbar. The physiotherapist mentioned, and this time's doctor mentioned that physiotherapists don't actually mention the cause. They just treat the symptoms and whatnot, and the root cause is not usually mentioned, or they don't help with that. But actually, my previous physiotherapist did mention it and did help with it. He didn't exactly mention hamstring being tight is the reason for the pain, lower back pain, but he did mention that hamstring is tight and what to do to keep it flexible and all that. But he didn't mention that if the hamstring is tight, then it can cause lower back pain issues if I sit for a long time and all that, and not exercising and all. Right? So he didn't connect the two, but he did say hamstring is tight and whatnot, and I'm not exercising, and it's like a very, very, very unfit body and whatnot. So yeah, so I went to the Apollo hospital in Bannerghatta Road in Bangalore, right? So I have some of the reports that I got, right? So if you notice, so one moment, let me get this, right? So this is the thing, right? One moment. So this is the Apollo, right? So I got the report, and so you can see actually the whole thing with the Bannerghatta Road. And let me show you the whole reports, or let me just read it out because I can't show all the information in it. But I can tell you like how much I paid and stuff and what they've mentioned. So for example, the first thing is, I had to get a consultation. So I got a consultation from this doctor, ortho doctor. So I went to the orthopedic doctor in Apollo. So I went to Manish Samson, Dr. Manish Samson. So he was a great doctor. I think he was a bit old and not too old. He was very chill and all. Like he was telling me that I should pick my partner every day and not just some days. And I paid 950 rupees along with taxes and everything. So consultation charge, outpatient OP consultation, first visit, so medical department and whatnot. So yeah, so no discounts, but yeah, this is how much I paid, 950. And this doctor spent like probably max 5 to 10 minutes with me, and yeah, I mean, the recommendation from the doctor was like, as in the report from the doctor is this. So first of all, let me tell that it's Manish Samson, and yeah, I mean, his designation is like he's basically an ortho doctor. So um, it is Department of Ortho and MS in Ortho. So he has done MS in Ortho and MCH in Ortho in UK. I don't know what that is. MCH Ortho, and then Joint Replacement Fellow in SG. I'm guessing it's Singapore, and then CANS in Australia, AUS. So and then Senior Consultant Orthopedic and Joint Replacement Surgeon. So I noticed very interesting images and information in his clinic, in his room, like regarding knee joint and stuff like that, and some interesting, what do you say, some models to show how knee joint looks like and all that, and about knee replacement and all. So chief complaints, so allergy, no unknown allergy, chief complaints. He wrote down that the patient comes in today for lower back pain and a slight cough. History of present illness, the patient presents with a slight cough. The patient presents with a slight cough and pain in the lower back that started after waking up. The cough subsided, but the pain persisted. The pain is localized to the lower back and does not radiate to the legs. So these were questions he asked: does it radiate to the leg or not? So this is not the first occurrence of the lower back pain. I told him that, but it's unclear if it's the same as previous episodes. The patient denies any burning sensation during urination. This was also asked for me, and the advice was rest, and then start core strengthening back exercises. So he did mention this, like start core strengthening back exercises, and of course hamstring stretching exercises. So and he also gave me some medicines for the pain, so kind of like painkiller and also a gel. So he basically said take Zerodol 100 mg tablet, which is basically aceclofenac, and then it's an oral tablet morning and evening for like 5 days after meal. And then there's a Power Jessic Plus 30 grams gel, which is diclofenac, um, and plus methyl salicylate, right? And it's a topical, it's a gel, and morning and evening, and take it for 10 days, right? So that is that, and let me just show you how it's like. So it's basically this, right? She's given this as the thing. So yeah, and his details are like given here. Just don't let me just hide the other unnecessary information so that we just get what is necessary. Just a moment. So that is information. So orthopedics, Manish Samson, right? And patient prescription. And the same is written behind also. So yeah. And yeah, and so you can actually see that I can also show you the bill that I got, right? Just a moment. So yeah, so this is the bill that I got, right? Manish Samson, OP consultation and whatnot. Yeah, and yeah, I mean, I also got, what else? I also got the medicines. So that is basically over here. So it says Zerodol, 100 mg and whatnot. and power the check, and it was basically some 231 rupees to pay, and I got it from the Apollo pharmacy itself. And yeah, so no discounts, but because I don't have any membership with them and all. So yeah, and then yeah, well, I showed you the medicines that I got. Yes, I mean the prescription that I got. This I showed you. So no allergy and whatnot in the medicines. And I was given some printouts to tell me what exercises to try and do. For example, for hamstring stretch, I was told to do these: step forward stretch, forward bend stretch. He said forward bend stretch might be too much for me, so don't do it now. Lunge stretch, and then forward stretch. This was something that I was told to try initially, right? And then the forward stretch to check with how much I can stretch. Single leg forward stretch, and then leg raise stretch. This was yeah, actually done this leg raise stretch from the first physiotherapist that I met, and then he told me about the different exercises for your back. So basically, wall slides, stand with back leaning against a wall, bring your feet 1 foot forward to the wall. Keep abdominal muscles tight while slowly bending both the knees. Hold for a few seconds and slowly return to the original position. Repeat this 10 times. Right, and then heel raises, stand on your heel balancing. Stand on your, I think this does not clearly, okay, stand on your feet, balancing yourself, holding on to a support, slowly raise your body up on your toes and hold for a count of 5. I think this will help with calf muscle. So then slowly return to the original position, repeat 10 times. And then standing arc, hamstring stretch, double knee to chest, hip rolling, press ups. These are some things that I've done before, like press ups and double knee to chest, and then not hip rolling though. And then cat and camel I've done before, back extension, not exactly. Pelvic tilt I've done, single knee to chest I've done, and then straight leg raises I've done, yes. So yeah, so for standing arc, you have to do stand with your feet apart and hands on your back with fingers pointing towards backwards, and bend backwards at the waist, supporting the trunk with your hands. Keep your knees straight and hold for a count of 5. Repeat this 10 times. Hamstring stretch, lie on your back with your legs up, and put your hands around the upper leg for support. Slowly straighten the raised knee until you feel a stretch in the back of the upper leg. So hold for a count of 5 and then return to the original position. Repeat with alternate legs. Double knee to chest. So grasp both your knees with your hands and pull them towards your chest. And hold for a few seconds and relax. So let your knees return, but keep them bent at arm's length. Right. So hip rolling. So lie on your back on a firm surface. Keep both your knees bent and feet flat on the surface. Cross your arms over your chest, right? And turn your head to one direction while turning both the knees to the opposite direction, right? So if you're turning left your head, then you should turn your legs to the right. So return to the original position and relax. Now repeat in the reverse direction. Repeat with alternate sides. So press ups, lie on your stomach and with your back and hips relaxed, and use your arms to press up. Concentrate on keeping your hips down and push up your upper body as high as possible. So yeah, and yeah, straight leg raises, lie on your back with one leg straight and one knee bent. So tighten abdominal muscles to stabilize lower back. So slowly lift one leg straight up about 6 to 12 inches and hold for a count of 5. Slowly return to the original position. Repeat this 10 times. And it didn't mention for both legs, but yeah, you have to do it for both legs, I believe. So single knee to chest, so lie on your back with both knees bent, hold your thigh behind knee, and bring one knee up to the chest. Hold for a few seconds, relax, repeat with alternate legs. Pelvic tilt, it's kind of like, I think, let's see what this is. Lie on your back on a firm surface. Keep your feet flat on the surface and knees bent. Push your back into the floor and by pulling the lower abdominal muscles up and in. Hold your back flat while breathing easily. Hold for a count of 5 and do not hold breath. So I think this I need to understand better, but yeah, it says you have to push the stomach towards the floor. I've also done the glute bridge, which my physiotherapist from years ago mentioned. I've done the cat and camel also. This is bending the spine and all that on your fours, right? So cat and camel, kneel down on the floor in all four position on your hands and knees. Curl your back to up toward the ceiling like a cat. Hold for a count of 5. Return to starting position. Pull your stomach down to the floor, hollowing out your back. Hold for a count of 5. Return to starting position. Repeat 10 times. And then back extension. Lie on your stomach on a mat. Place your arms at your sides so that your hands are by your hips. So raise your head and shoulders off the mat as high as comfortably possible. Hold for a few seconds, lower the head and shoulders. Do not tense your shoulder muscles. Repeat for a few times and relax. And there are some do's and don'ts. Bend your knees as you tilt, as you lift. So bend your knees as you lift. So you have to bend your knees. Without bending, you should not just stand straight, and without bending, like when you lift stuff. So make your legs do the hard work, not your back. So you should use your legs to lift stuff like heavy things. And so I actually also lifted heavy things, like I was lifting these cans, right? So yeah, but I lifted it properly only. But yeah, sit with a rolled up towel or some other support behind your lower back. So this, I think my physiotherapist told me long back. So and same for, I think, lying down like on a surface. So have your work surface at a comfortable height. Use a firm mattress on a firm bed to sleep. This was also mentioned by my physiotherapist long back. Sleep on your back with a pillow under your knees, or sleep on your side with your knees bent and a pillow between them. Wear flat, low-heeled, comfortable shoes. And the don'ts are: don't lift objects away from your body with your arms outstretched. It has to be close to your body. So, and then don't lift objects that are too heavy for you. And then don't slouch in your chair. This I do a lot these days. Don't stand for a long period of time without changing your position. Don't sleep on your stomach. So these are some of the things that they mentioned, and the remaining is basically my sitting position, the posture, correct sitting position. So upper back straight with shoulders relaxed at sides. So back rest of the chair supports curve in the lower back, right? And hips as far back on the chair as possible. So it should be behind as far back, and adjustable seat for optimal height. And then your eyes should be at 20 to 28 degrees, like around 30 degrees max. Top of the monitor at eye level or slightly below. So arms relaxed, right? You have to keep your arms relaxed at sides with upper arm and lower arm forming a 90-degree angle. So wrists straight with fingers relaxed. So, or else you might get a carpal syndrome and all if wrist like rest your wrists on the table and whatnot. So lower legs at 90 degrees or greater than 90 degrees. So it should be, I was told it was 90 degrees. It shouldn't be acute angle. It should be obtuse angle, 90 degrees or 90 at 90 degrees. and then greater than 110 angle to thighs with adequate leg room above. So I need to understand what that means. I think 90 to 110 or just 90. This doesn't seem like 90 though. So 110 angle to the thighs with adequate leg room above. So there should be some adequate leg room above your feet, above your knees, right? So between the knee and the table. Feet flat on the ground or resting on a footrest, right? The feet should not go behind. So this is something that I was told, and not cross the legs, right? So this was told in my years ago physiotherapist consultation. So yeah, that's what happened recently when I had a lower back pain and I need to do the hamstring stretches. I get to do the hamstring stretches because I mean it's an important thing and I like to be healthy. And I get to also exercise more and not suddenly run a lot someday and not suddenly bend my back too much when lifting heavy things or lifting my partner and all, and being very careful with heavy weights and lifting heavy weights and being careful about my posture and whatnot. So yeah, I just wanted to talk about this recent healthcare, the whole hernia and everything, and how it was not a hernia, thankfully, and yeah, just a lower back pain, but it will last for some time, and apparently at least 6 weeks. And I'm not surprised because I have messed up my hamstring for years now. Like I haven't stretched it much. At least in the last 8 months, I surely didn't stretch it. Before that, in the gym, I used to stretch it a bit before doing leg exercises. So yeah. So yeah, that's all I had for this video. I'll see you in the next one. Bye bye.